Have you even had grapefruit juice?
I've never had a grapefruit juice.
Let's give it a try. I mean, a little bit of
That
that,
sounds refreshing.
a little bit of that.
Jeez.
Give it a try. That's not good. That's not good. It's not good. I don't know who's
That's freaking bitter. The aftertaste. Let it settle in your
It's
mouth.
not, yeah, it's not good. It's not. It's kind of refreshing.
Again, it is refreshing. I can't lie.
All right, welcome back to the Medicine Cabinet. We're your hosts. I'm Dr. David Stewart.
And I'm Dr. Kia Bozami.
We are practicing pharmacists, and today we're going to be talking about drug interactions. You know, what they are, why they happen, and of course, why grapefruit juice could be a problem. So, Kia, start us off. What is a drug interaction?
Okay, so let's go kind of the most basic definition of a drug interaction. It is basically a change in the effect of a drug when it is taken along with another substance. And when I say another substance, we're talking pretty much anything. It could be another prescribed medication. It could be an over-the-counter vitamin. It could be Advil.
Yeah, it could even be cigarettes.
It could be cigarette. It could be caffeine that you're having. It could be so many things.
Yes, and so to better help understand what a drug interaction is, I think it's good to first understand what happens when you take a medication by mouth.
Exactly.
What happens?
Yes, so when a drug is taken by mouth, it usually goes through different stages. So first, the drug goes through the digestive system and then into the bloodstream, and that's what we call absorption. Next, it travels to different parts of the body, and that's what's called distribution.
Yep. And eventually the body will break down the medication and it will transform it into different molecules, metabolism, and finally the drug is cleared from the body, and that's called elimination.
Exactly. And so drug interactions can happen at any one of these different four stages, and we can call those types of interactions pharmacokinetic drug interactions. And so, for example, let's say you take an iron supplement at the same time as a specific antibiotic called doxycycline. And when you do take these two together, it forms a complex that is poorly absorbed into the bloodstream. And so eventually what that means is the drug will not be able to do what it's supposed to do, and it may not help you treat the infection.
Exactly. And so just like that can occur, it's also possible for drugs to have additive or opposing effects. And those types of interactions are called pharmacodynamic interactions. So one example might be the blood pressure medication Ramipril and the other blood pressure medication hydrochlorothiazide, right? Both medications lower blood pressure on their own. And so when you take them together, as you might expect, the blood pressure is lowered even further.
Absolutely. And so just like drugs can work together to do the same thing in additive ways, they can also have opposing effects. So for example, let's say that same patient starts taking ibuprofen or that brand name being Advil, consistently taking that every day while on these same two blood pressure lowering medications. The Advil itself can increase the blood pressure, and so these would have an opposing effect and in a way kind of cancel out the blood pressure effects.
Yeah, so that's a bit of a background on how drug interactions work, but where does grapefruits come into the picture? I know we've heard a lot about grapefruits.
Just did a little taste test.
Exactly. So where does grapefruit juice fit in?
Yeah, so it is true that grapefruit juice and grapefruit itself can interact with a lot of different medications. And the key to this is an enzyme in the digestive tract called CYP3A4.
Yeah, this enzyme's job is to break down drugs in the digestive system before they can enter the bloodstream. And so grapefruit juice blocks that enzyme, CYP3A4. And when this happens, it cannot break down the drug effectively. And so more drug ends up entering the bloodstream than what was originally intended. And that can be a problem because it can lead to increased side effects or sometimes even toxicity.
Exactly. So for example, the drug Lipitor, or also known by its active ingredient or the generic name atorvastatin, is a medication used to lower your cholesterol, and it interacts with grapefruit juice. So the prescribing information that I was reading says that for 240 milliliters of grapefruit juice, your exposure to the drug can increase by 37%.
It's quite significant. I actually read in the same monograph that if you were to drink 1.2 liters of grapefruit juice, don't know who's doing this, but it could increase your exposure by up to 150%.
Wow.
So these drug interactions can be quite significant. So with the Lipitor or atorvastatin example, having increased levels in the bloodstream could lead to more side effects like muscle pain.
Exactly. And so just kind of as a side point as well, not all drug interactions are harmful. Some of them actually produce desired effects. And if you would like to hear more examples of these, drop a comment down below and
Down
we'll
below.
make another video for these.
Yeah, that's right. And often drug interactions, if you're wondering how they're managed, they can be managed very differently. For example, sometimes it's as simple as separating 2 tablets by a few hours. Other times you might not be able to take the medications together at all. So it really depends. Always make sure, of course, you check with your healthcare team to make sure what is the best plan for you. Thank you guys for watching. That's everything on drug interactions. If there's any questions, make sure you leave them in the comment section below. And,
Smash the like button,
subscribe, post notifications.
Yeah,
That's pretty much. See you guys in the next video.
Peace.